If you, like me, assumed that chiropractic care started as a subset of normal medical practice, think again. It's about to get weird. Chiropractic care was invented in 1895 by Daniel David Palmer. His profession? He was a grocer. He said that his side hustle was magnetic healing. But you can't just call yourself a healer. You actually have to do stuff, right? Let's just say that the standard of proof has changed a bit in the last 130 years. According to Palmer, he restored a janitor's hearing by adjusting his spine. You heard that right. The spine adjustment cured deafness. We're not off to a great start. Palmer believed that subluxations, misalignments in the spine, interfered with the body's innate energy and could cause disease. His term for this mysterious life energy? Innate intelligence, which sounds more like an MLM training course than a medical theory. Importantly, this idea didn't come from anatomy or science. It came from metaphysical speculation. Palmer claimed chiropractic knowledge was revealed to him by a ghost. A ghost? Boo. And somehow that ghost's spectral insight became a billion-dollar industry. Welcome back to Dad Ruins Everything. Last time I ruined essential oils. Some smell great, some hurt your pets, and none cure your ailments. Check out the linked video if you want to know more. Today, I ruin chiropractic care, because crack is whack, kids. That's right, it's time to talk about the back-popping, neck-twisting, spine-whispering world of chiropractic medicine. Let's get into it. Let's talk about how chiropractic care went from fringe storefront practice to, well, less fringe. Back in the 1960s and 70s, chiropractic care was barely regulated in much of the United States. The educational requirements varied wildly from state to state, and in some areas, chiropractors didn't even need a college degree. Just a pulse, a spine chart, and maybe a neck-snapping seminar behind a bowling alley. There were no national boards. There were no accreditation requirements. There were no formal licensing exams in many states. The entire profession operated in a legal gray zone, often targeted by the American Medical Association as unscientific quackery, which, to be fair, wasn't entirely off base. In fact, the AMA actively campaigned to contain and eliminate chiropractic care through the 1960s and 70s, which led to a massive lawsuit in the 1980s. Spoiler, chiropractors won, but not because their treatments were proven. Mostly because the AMA had conspired against them in ways that the courts didn't like. Fast forward to today, and modern chiropractors must complete a Doctor of Chiropractic degree, typically a 4-year postgraduate program, take coursework in anatomy, physiology, radiology, and biomechanics, pass a 4-part National Board of Chiropractic Examiners exam, get licensed by the state in which they practice, and complete continuing education classes to maintain their license. So, does that mean all chiropractors are now science-based experts? Not exactly. While training has improved and some schools have moved towards evidence-based approaches, many chiropractic programs still teach subluxation theory, the original debunked idea that tiny misalignments in the spine are the root of all disease. This means that some graduates walk away with just enough clinical training to help with back pain, and just enough pseudoscience to think they can cure asthma, ADHD, and fertility issues. And unlike medical doctors or physical therapists, chiropractors aren't required to follow evidence-based guidelines. There's no national oversight body reviewing their treatment protocols, and they're largely free to decide what kind of care to provide, even if it's based on 1890s ghost medicine. So yes, training today is better than it was. But the gap between regulated profession and science-based healthcare is still wide enough to drive a spine-adjusting RV through. When states began tightening their licensing laws, particularly between the 1960s and 1990s, many chiropractors who were already practicing were not retroactively required to meet the new educational or examination standards. Instead, they were often granted licenses under grandfather clauses, which allowed them to continue practicing based on their previous training, sometimes from unaccredited or correspondence schools, years of practice experience, and passing a much more lenient or state-specific licensing exam, if any. This means that some currently licensed chiropractors never completed the modern Doctor of Chiropractic curriculum, never passed the current MBCE board exams, and may still base their treatment plans on substantially outdated or debunked models, like subluxation theory, innate energy flow, or adjusting away ear infections. These practitioners often maintain loyal patient bases, particularly in areas where chiropractic care is viewed as a holistic or alternative health system. But it also means that there's a wide variance in quality and beliefs within the field, with some older chiropractors still operating on ghost whisperings. If you're seeing a chiropractor, especially one who's been in practice for 30 plus years, it's absolutely fair to ask where they were trained, whether they believe in vertebral subluxations as a cause of disease, if they routinely coordinate care with physicians or physical therapists, and whether their treatment recommendations are based on current evidence or vitalistic philosophy. Because in a field where past credentials were handed out like candy canes, a white coat and a spine chart aren't enough to assume competence. But let's say you have a present-day chiropractor with an impressive amount of graduate school education. Even with this improved training, there are chiropractors who say they can treat back and neck pain, improve posture and mobility, reduce headaches, boost immune function, and realign your spine to fix everything from asthma to ADHD and digestive issues. The first few items? Sure, maybe. The rest? That's where things go off the rails and straight into pseudoscience canyon. Population? Your spine. I don't want to use too wide a brush, because I'm sure that there are skilled and ethical chiropractors, but the field is rife with care that thrives in the same space as wellness grifts and natural healing. For example, reoccurring appointments or even subscription plans are encouraged, sometimes 3 times a week, for life. Subluxations are diagnosed even without symptoms. X-rays are taken unnecessarily. Hello, radiation exposure. And some chiropractors sell supplements, posture correctors, or detox kits in the waiting room. This isn't always medicine. Sometimes it's a subscription service for spinal placebo. But what does the science actually say? Let's break it down with some real evidence. Low back pain. Some spinal manipulation can provide mild to moderate short-term relief, but not necessarily more than physical therapy, stretching, or NSAIDs. It's not useless, but it's not magic either. Also, there's no evidence that it prevents injury or improves posture long-term. For chronic or complex issues, physical therapy and medical evaluation are far superior. Neck manipulation can be risky with minimal benefit. High-velocity neck adjustments have been associated, albeit rarely, with stroke due to damage of the vertebral artery. Even if it's rare, it's a real risk for questionable gain. For non-musculoskeletal conditions, there's no credible evidence that spinal adjustments cure asthma, ear infections, hypertension, or whatever else your chiropractor's sandwich board says this week. For babies and children, adjusting infant spines is not only unsupported by evidence, it's potentially dangerous. Any healthcare provider that's recommending spinal manipulation for colic or growth alignment should not be treating children. Period. Lastly, it can create psychological dependency, where people believe that they need adjustments to stay aligned, even though spinal alignment in that context is largely a myth. In case you think that chiropractic care fits into the tapestry of specialties for treating medical issues, you should reference this chart to see what the overlap is with orthopedists, physical therapists, and chiropractors. Spoiler: one of these things is not like the others. If you're going to go to a chiropractor, you should be able to spot the red flags. It wouldn't be fair or accurate to say that all chiropractors are quacks. Mom, the creative, regularly sees one and is satisfied with their treatment. I think it would be fair, though, to say that it financially benefits a chiropractor to have clients returning on regular schedules, whereas it's generally the goal of most medical professionals to treat a root cause and eliminate it if possible. If you're dealing with mechanical back pain and the provider has the appropriate licensure, doesn't make medical miracle claims, collaborates with physicians or physical therapists, and doesn't pressure you into prepaid treatment plans, then it might be a valid part of a broader care strategy. But here are some red flags that should make you run. Your spine controls every function in your body. We need to schedule you for 30 visits over 10 weeks. We can cure chronic disease with adjustments. Don't get vaccinated, just get adjusted. Or your child needs spinal correction to grow properly. If your chiropractor is saying any of this, get out of there, and don't rebook on the way out. Here's the biggest issue. Some chiropractors make wild health claims that keep people from seeing real doctors. If someone delays getting medical treatment for a serious condition and instead gets their spine cracked by someone claiming to boost immune function, they could be risking their life. Chiropractic care is often marketed as a safe alternative to medicine, but it's only safe if it's not replacing actual medical care. So you might be wondering, is chiropractic care as popular in countries with universal health care? Or is this another uniquely American blend of wellness marketing, private pay, and pseudoscience? Let's take a quick international tour. We'll start in the United States. Chiropractic care is most popular here, and that's not a coincidence. The U.S. has a privatized healthcare system where patients often pay out of pocket for treatments not covered by insurance, including many chiropractic visits. Chiropractic care is a $15 billion a year industry in the U.S. alone, and marketing plays a huge role in its success. Many Americans turn to chiropractors as a natural alternative to medical doctors or physical therapists, especially when primary care is expensive, slow, or inaccessible. That's not an endorsement of chiropractic care. That's a symptom of a broken healthcare system. Up north in Canada, chiropractic care is also fairly popular. It's regulated in all provinces and covered partially under some provincial plans and private insurance. However, it's more integrated with mainstream healthcare than in the US, and chiropractors generally stick to musculoskeletal issues. That said, Canadian provinces differ wildly in how tightly they regulate chiropractic claims. Some still get away with marketing spinal adjustments for asthma, digestive issues, or infant colic, even though there's no solid evidence for any of that. Across the pond, in the United Kingdom, chiropractic care is legal and regulated, but far less mainstream. It's not widely available under the National Health Service except in limited musculoskeletal clinics. You're unlikely to find public funds covering weekly adjustments or wellness plans. Also worth noting, in 2010, after a massive public backlash from skeptics, including a legal case involving Simon Singh, UK chiropractors were pressured to tone down the false health claims. Many were advertising treatment for conditions like colic, asthma, and ear infections until the General Chiropractic Council cracked down, pun intended. Down under, in Australia, chiropractic care is licensed and regulated, but there's an ongoing controversy. Some chiropractors limit themselves to treating back and neck pain. Others still believe subluxations block life energy and promote spinal adjustments for kids and babies. The Australian Medical Association has been openly critical of chiropractic care's pseudoscientific elements, especially when it comes to children's care and anti-vaccine rhetoric from certain practitioners. We find that in much of Europe and Asia, chiropractic care is either not legally recognized, considered an alternative or complementary treatment, or restricted to physiotherapists or osteopaths who have completed medical training. In countries with strong public healthcare systems and good access to physical therapy, chiropractic care isn't nearly as widespread, because patients don't need to seek out spinal sorcery when they can just, go to a doctor. So to answer the question why chiropractic care isn't bigger outside of the United States, it's because when science-based, publicly funded medicine is widely available and affordable, people are less likely to gamble on unproven or ineffective treatments. The more desperate people are for care, and the more they have to pay out of pocket, the more likely they are to turn to health fads, magical thinking, and charismatic backcrackers. So yes, chiropractic care exists around the world, but no, it's not nearly as popular outside of the US. The country that gave us energy crystals, alkaline water, and colon cleanses is still Chiropractic HQ. So the bottom line is that chiropractic care started with ghost advice. It promotes mystical spinal energy and often veers into pseudoscience. Due to the current licensure requirements, the field now has more legitimacy than it ever has before. Despite this, chiropractors are not doctors of medicine. Any that act like they are should have their licenses adjusted. You could forward them this video, though I doubt it'll align with their truth. Some chiropractors offer limited relief for certain back issues, while others offer snake oil and scrubs or a lab coat. But a key takeaway is that you could get proper imaging, get a referral to a medical specialist, and rebuild strength and flexibility through evidence-based rehab. This will help you from missing diagnoses, herniated discs, fractures, or even tumors. If you learned something, or if your spine cracked just from hearing all of this, hit like and subscribe. Drop your weirdest chiropractic story in the comments, and if your chiropractor recommended homeopathy too, that'll be on the chopping block soon. If you're sure I'm wrong about chiropractic care, feel free to give me an adjustment in the comments. Just understand that anecdotes aren't evidence, so it's best if you bring scientific receipts. Thanks for watching Dad Ruins Everything. Have a well-aligned and medically sound day.